So, man, this is crazy time, that we're in health-wise with the pandemic, and so many people are super anxious about what's going on with COVID, and we don't know what's going to happen. There's the unknown. There's a lot of anxiety. There's a lot of concern, and this is a situation where my guess is a lot of you guys are experts at dealing with, and um, you know, uh, pain warriors and CRPS warriors have been kind of fighting that good fight for so long that my guess is you guys have a lot of good advice to help this country sort of get through the challenge that we're in. And kudos to you. Today, my talk is focusing on kind of the mind-body connection, the pain brain, and what goes on within the brain and how it connects to the body, and how it ultimately affects the experience of CRPS that we have. And so, going to be talking about conquering the brain. And when what is the purpose? What is my life purpose? What is the purpose of today's talk? And it's really one simple thing. And I want to help people have a great life with chronic pain. And if you have CRPS, you can have CRPS and still have a really great life. And for me, that's the goal. And when I go to work every day, when I work with patients every day, that's the goal that I have. What can I do? What can I help? What tools can I help people get? What treatments, recommendations? What does it take to help the person in your shoes, in our shoes, to have a really, really good life with whatever struggles or challenges that we have? And that's what it's all about. And if there's any things that you get out of this talk today that you can take with you that will help you get on that road, that path to having a really great life with whatever the health challenges that you are, then I'll be really happy. I'd like to say that people who know me know I'm a big Harry Potter fan, a huge fan, and there's a part from the last book, if you've read the books, and an interesting scene, and they did kind of a cool job of it in the movie, if you happen to see the movies, where Harry is just struck down by Lord Voldemort, his evil tormentor. And, in a lot of ways, Voldemort is kind of our pain, in some respects, and always out to get us and out to tear us down. So finally, he's struck down. And then all of a sudden, he finds himself in this sort of surreal place that looks like some kind of purgatory. And, he's walking, and then all of a sudden, he sees his old teacher, Dumbledore, Professor Dumbledore, and they start walking and talking. And Dumbledore, who'd already been, died, in the book before, or some time before in the series. And Harry doesn't quite know what to make of all this. And he's looking around, and he says, Professor, is this real, or is this all in my head? What's going on? And Dumbledore looks at him and says, well, of course, Harry, it's in your head, but why would that mean it's not real? And I think what we start to understand is what's going on up here in our brains is a very complicated situation that develops when we have CRPS, and it creates an experience, and we experience it in our head, but it's very real, and of course we see it in our bodies, and we see it in the world that we live in, and it kind of segues into how I want to present this topic a little bit. And when we're talking about the pain brain, we can kind of break it up into a couple basic topics, one being the structure of the brain and the other the function. And the two, structure and function, kind of go hand in hand. And when we're looking at the sort of structural part, we have the gray matter, which is kind of like your hardware. It's like your computer hardware. And then we have what we call the white matter, which is kind of the cables and cords that helps all the information spread around in an efficient, effective way. And when we see somebody who's experiencing CRPS or some sort of very complicated chronic pain experience, the brain goes through a whole set of very complicated structural changes with all of this. And these structural changes lead to significant changes in function. And so as this all changes, this is the challenge that gets presented to us when we want to get well, we want to feel well, and we want to have that great life. What sort of structural changes do we need to make to create function changes so that we can basically move on from this problem? And that leads us to, playing this game, playing the brain game. What are the cards that we're dealt that we can use to play with to win this and beat the pain? And I'm breaking it down into a couple of different sort of definitions that I want you to, just kind of be aware of. And you've probably heard or read about a lot of these already. But the first one is the concept of neuroplasticity. And what that means is our brain, our nervous system is very dynamic. It's not fixed. It doesn't stay in just a fixed position and it just stays that way. It's always evolving, always changing, always adapting based on what's going on within us and outside of us. And so it becomes a very moldable, shapeable, adaptable thing. And that's why we say it's plastic, it's neuroplasticity. Another interesting concept to understand about how our nervous system works is something we call neurogenesis, which means that we have the ability to create and grow and formulate new nerve cells. And we can even do this as we get old. And we see that there's certain interesting parts of the brain where neurogenesis can take place. So we see that we have this ability to evolve, adapt, and grow in different ways. Another interesting topic in the world of understanding pain management and understanding nerve pain like CRPS is this thing called epigenetics. And so what that refers to is, we all have our genetics, right? We have the genes we inherit from our parents, and that doesn't necessarily, our genes don't change as we move on in our lives, but the way we express our genes, the way we turn certain genes on and off, can change or be modified depending on what's going on again in the environment within and without us. And we start to see that when somebody has a chronic pain problem like CRPS, we see a wholesale set of epigenetic changes, meaning certain genes are turned on and off within our central nervous system that takes us into this sort of high level of distress and high level of pain. And so we're learning more and doing research and following that topic. So that's another one to kind of keep your eye on. Another interesting player in this brain game are the glial cells. And some of you maybe have heard or read a little bit about them, but about the nerves. In our nervous system, in our brain, we have all these, millions and billions of nerve cells, but we also have all these other supportive cells that are hanging around all these nerves within our central nervous system called glial cells or microglia. And, we used to think that these cells were just there to kind of provide a little help or a little support. But what we also find is they can do a lot more than that. And they seem to play a role in turning up the intensity of the pain and flipping a switch into turning something from maybe acute pain into becoming a more chronic pain problem. And so maybe play a big role in feeding the fire of a burning pain problem like CRPS. And so we're studying more and learning more about what kind of things can we do to not let the glial cells play that role in our pain brain game. But when you put all that together, you start to see, the neuroplasticity, the moldability of our nervous system, the ability to grow and develop in different ways, and the ability to turn things on and off, depending on what we do or how we experience our environment. We start to see something very powerful. And what we see is that we have the power within us. You have the power to do a lot in this situation, maybe a lot more than you ever realized, as far as remodeling this pain brain and working on starting the process of changing the structure and function and taking it down a direction that you want it to go. And you start to take control, take charge of you, as opposed to the pain being that guy, taking control back from that Voldemort. So as we start to see changes develop when we're experiencing pain, as the CRPS problem goes on and becomes more chronic, we see a lot of different parts to this that get remodeled into a challenging situation. We start to see changes in how we govern or regulate our mood, and we might start to see mood swings, moodiness, depression, anxiety. These starts to become more and more part of the problem. We start to see memory and learning changes take place. Our ability to remember and process things. I've heard patients talk about this with me for many, many years. We used to not really understand why that was, but now we're starting to understand more and more that experiencing pain can definitely lead to cognitive difficulty and memory and learning problems. So we start to understand more about how that happens, what part of the brain where that's affected by pain. And we start to see that, let's face it, being in pain is stressful, and it creates can create a significant stress response, with things like the fight or flight response and all these different things and changes in our hormones and other factors in our system that sort of create this sense of high alert and high stress. So we start to feel that throughout our not only our nervous system, but also throughout our bodies. And then we also have something in the brain called the reward system, and how we are sort of, at peace with our daily lives and the way that we interact with what goes on in the world around us. That starts to change, and we start to see changes there. And then we also see changes in part of the brain that help regulate kind of our executive functioning, meaning, what kind of choices, what kind of decisions do we make? What motivates us to do things or takes that motivation away? Am I going to get out of bed today? Am I going to leave the house? Am I going to exercise? Am I going to go to work? Well, how do we want to lead our day? We start to see remodeling and changing in that part of the brain when pain goes on for a chronic basis. We also see other changes, things like impulse control, how we act in the moment or interact in certain situations. That starts to maybe change. We start to see changes in, how we think about things, how we feel about, the opinions that we have, the judgments that we have, that can be modified and changed through this whole sort of pain-brain experience. We also see significant changes to our thoughts and feelings, the attitude. How do we, feel about certain things? Another thing that gets disrupted is sort of this homeostasis. Normally our brain and our body is in communication all the time to keep things in a normal state, as far as like how our body moves, our breathing, our heart rate, our blood pressure, all those things. And all of a sudden, when you're in pain for a long time and you have CRPS, that can get significantly disrupted, and you start to see changes in the way the whole mind and body interact and regulate with each other, and you might start to develop other health problems or other vital sign changes that are a sign of this disruption. And then certainly sensory, how we sense the world around us, sensory changes. It's a big deal with CRPS in particular. Because we know that studies have shown that we start to have a hard time discriminating where we're feeling things in our body sometimes. Sometimes the way things look seem distorted. We look in the mirror and how we see ourselves and how that all gets, remodeled and rewired. We start to see things about ourselves maybe look different than they really are. We see all these sort of crazy changes in our sensory system take place, and so all this havoc, happens in this rewiring and remodeling taking place within our nervous system, which is in constant communication with how our body feels and functions. We want to, we want to conquer this situation. We want to come out of this with a great life, and we want to start a process for ourselves where we can figure out how can we create some structural change that will lead to functional changes that will help us feel like we're doing so much better with the problem that we're dealing with. And I kind of talk about, using the R's to help And remember, we talked about neuroplasticity, we talked about neurogenesis, we talked about epigenetic changes. And so we can use that information to empower us to start to use these R's to remodel, rework, revise, reconfigure, regenerate, rejuvenate. And then the last one I think is important is repetition. And when we're trying to create lasting, changes in remodeling the way our body and brain is communicating with each other, and we want to do it in a more lasting way, we might have to keep doing something over and over again. We know that we can't just do something one time and expect everything's going to be, hunky-dory, good as gravy tomorrow, and then off we go. These are things that sometimes we have to keep working on over and over and over again until those new neural networks start to be more secured, more embedded, and start to become more a part of who we are. And so it's important to not give up and to stay resilient, keep fighting the good fight until you reach the goals that you have for yourself. When you're working with your healthcare team, when you're working with your doctor, I like to talk about what I believe are the 5 key elements of success. And if you keep these 5 elements in the back of your mind or write them down on a piece of paper and use that when you're navigating your treatment and your medical care and your doctor visits and your other visits, and sort of keep track of how things are going and is it going in the direction that you want it to go, keep in mind, try to remember these 5 elements. The first one is mobility. And when you think about quality of life and how well your life is at any moment, a lot of it is connected to how mobile you are. The more you can get around, the more things you can do, the more you can interact, the more you get to experience life, and the more you can do. And so remembering mobility and having that be a part of whatever you're trying to accomplish with your treatment, I think is important. Second one is interaction. Having a pain problem like CRPS can mean really disruption to our sort of social life, our social circles, our social connections. And we know that social interaction is a really important part of good quality of life and good health and well-being. But nothing can sort of interrupt that more than being in pain. It might mean you don't want to leave the house, you don't want to talk to people, you might start to feel more withdrawn. Maybe you're not able to go to work anymore, you're not interacting with coworkers. Maybe it's causing difficulty in relationships that you have with your spouse or significant other. So what kind of treatments can you bring into the mix that will help improve your ability to interact with others? And it doesn't have to be a lot, and it doesn't have to be on Facebook, but it can be high quality interactions. Third one is improving independence. And let's face it, nobody wants to be dependent on other people for things. We want to be able to take care of ourselves as much as we can. And so again, when you're working with your medical team, your treatment team, think about what treatments or things you're navigating or thinking about, and ask yourself, is this going to help me be more independent? Because if it does, my guess is that will also improve your quality of life of dealing with and managing something very challenging like CRPS. My number 4 on the list, you probably wouldn't have expected, but is validation. And I think this is a very, very important one. And what I see, what I hear when I talk to patients is, I think a lot of folks in pain feel alone, feel isolated. If you have CRPS, there's not a lot of other people who have CRPS. Maybe you've never even, where you live, maybe you've never met one other person who has it. And you feel kind of isolated, and you feel like maybe your friends and family, your spouse, they don't understand what you're going through. They don't get it. They don't know why you're not getting better. Maybe sometimes when you see your doctor, maybe you don't feel like they really appreciate or fully understand, the shoes that you're walking in. And I think that happens very, very easily when you're walking in those shoes. And I hear people talk about that a lot. And I think it's very important to understand that this is, really one of the most challenging problems in medicine to have and deal with, regardless of how you look on the outside. What you're dealing with on the inside is one of the true challenges of medicine, and figuring out some ways to help educate the people around you so that they understand and appreciate that a little bit more, so that you feel a little bit better understood. That's really important, because otherwise, when we don't feel validated, we feel very isolated, and when we feel that way, we're not leading a good life. My last one on the list, which I think is the most important thing, not only on my list, but the most important thing in the world, is love. And when you talk about all the things I just mentioned, the problems getting around, problems interacting, feeling isolated, all these different things, really what we're talking about is, nothing can strip love out of your life more than pain can. And being in pain and having a pain problem like CRPS, if you think about what is the most basic core human need, human value to having a really good life, it is love. And love, actually, it's a two-way thing. We all need to be loved by other people to feel that love. That's critical. But the other critical part to being truly fulfilled in your life is to be able to express love to others. Because when you do that and you're the person giving of love to others, you feel so much better, so much greater. And so whatever treatments you do and whatever your path is, if it's not helping bring more love into the situation, then you need to kind of second guess it and figure out what needs to be done different, because that is so important and so not talked about. So when we're experiencing something like CRPS, it's like living in a storm, big time hurricane storm. And we know that when we're experiencing an intense level of pain on a day in and day out basis, research has taught us that, for a lot of us anyway, it's like experiencing trauma like PTSD. And we start to see signs of trauma when we start to test and evaluate people who are in chronic pain for an ongoing period of time. And signs of feeling trauma that maybe you can relate to is mood swings, being moody, having flashbacks, panic attacks, feeling panic attacks, feeling social isolation, wanting to disconnect from other people, and having nightmares. These are all signs of feeling symptoms of trauma that are very common when chronic pain continues for a long time, and really common with challenging CRPS problems. And then, so this trauma experience leads us into this whole hyperactive stress response that you've probably heard, the fight or flight response when you're faced with danger. Like you're out in the jungle and a lion's going to attack you. You go through this fight or flight response where you either run as fast as you can to get away from the danger, or you fight it off to try to ward it off to protect yourself. But some trauma experts like Peter Levine talk about a third part of that equation, which is fight, flight, or freeze. And that's when the trauma you're feeling is so intense that you can't move, you can't do anything, you can't act, interact, you just sort of shut down. And I think that happens to a lot of people. And that's why it's so important, if you're feeling trauma experiences, to get it evaluated and get help, because otherwise you're stuck, you're frozen, and you can't move on to responding well to other treatments, and you definitely can't move on to the great life ahead. I often talk about three parts of trauma, three phases of trauma that I see. There are three different types of trauma a person might experience who has a chronic pain problem like CRPS. One is when you've had a prior traumatic experience in life, maybe many years ago, maybe in childhood, and then all of a sudden now you have a pain problem, maybe an injury, something happens that triggers something like CRPS, and this past trauma experience, what you went through, as far as how your nervous system reacted, there's a little memory of that in there, and it sort of gets triggered. And then all of a sudden these trauma symptoms start to come out again. Even if we're not thinking about the past trauma, the sort of physiologic reaction that we have comes out. So that's one. The second type of trauma that I think we can see with something like CRPS is the accident or the event that maybe caused the problem, the CRPS problem or the pain problem to start. Whatever that was. Maybe it was an accident. Some sort of event that may have been a traumatic event, and now that becomes associated with the injury and the pain that you experience from that every day, and they start to be interconnected. And so as we're experiencing pain every day, we're also experiencing trauma and PTSD-like symptoms every day, which makes the treatment of the problem that much more complicated and difficult. So that's the second type. And then the third type of trauma that I see can happen is the trauma of just being in pain for a long time. Let's suppose there was no prior trauma. And let's suppose the problem, maybe didn't start in a traumatic way, but you've been in pain now for 6 months, 6 years, however long, day in and day out. That starts to become, I think, traumatic in of itself. And then we start to see these trauma symptoms like the mood swings, the nightmares, the isolation, those kind of things. And when we start testing the brain and what parts of the brain get activated when we're experiencing symptoms of trauma, we start to see all kinds of things change. We see the amygdala is a part of our brain that deals with our mood and emotion regulation. That gets hyper-aroused. It's on a state of hyper-alert. Parts like the hippocampus, where we deal with learning and other things, that gets affected. Other parts of the brain that deal with like our personality and how we regulate our mood and feelings and things like that. All of that gets disrupted by this intense feeling of trauma that happens a lot with chronic pain problems like CRPS. So in order to get better, in order to move forward, we got to calm this storm down, and we want to talk to our providers, our healthcare team about what kind of help can we get to calm this storm down so that we can walk away from that and move on to the next steps of what we want to do. One way of doing that is through meditation. Meditation really, more and more research is showing, really positive, profound effects on the brain, on this neuroplasticity and some of the other things that we've been talking about. And there's sort of the more traditional still meditation that we think about. And you can also do active meditation if there's a way you want to incorporate it into moving or walking. So think about getting help with learning more about meditation. Of course, there's a lot of apps now for everything. Breathing exercises, simple breathing exercises can help calm the nervous system, calm the storm. And we describe it, how it helps is by something called parasympathetic induction. And the parasympathetic part of the nervous system is a part of our nervous system that helps calm things down. Sorts relaxes the heart rate, helps reduce the blood pressure, starts to create a calming sense throughout the nervous system. And the right kind of breathing exercises help us do that. So learning how to do that, really important. And in our center, for many, many years now, we've done some really great, amazing things with art therapy. And we see that art therapy does some really interesting things to the brain when we start to do research on it. And we see that it also helps improve our ability to better regulate or decrease our pain symptoms. And we see changes in a part of the brain that deals with that called the periaqueductal gray matter area. But really interesting. And, when we first started doing art therapy many years ago, you really most people didn't know what that was. And it certainly wasn't connected with pain management. But I think it's starting to grow in popularity, and you might start to be able to find practitioners in your communities now that you can reach out to. It's another great way of calming the storm and getting a better handle on really the pain management. Also, we're starting to see great research come out on yoga and creating very positive neuroplastic changes, which can be really therapeutic. And I like to say, don't think of yoga as exercise. Think of it as therapy. And it doesn't matter if you're not able to do things, that you maybe typically think of that you associate with yoga. It's all about modifying what's right for you and it can even, yoga can be done in a chair. So there's so many different ways of modifying it and still getting and taking advantage of what it has to offer. Last one on my list is something that you may or may not have ever heard of called EMDR, which stands for eye movement desensitization and reprocessing. Yeah, that's a mouthful, but it's basically a specific form of trauma therapy that you do with a one-on-one with a therapist that uses eye movement exercises to help reprocess traumatic feelings, and for some people can be quite effective. And another one is this subject that I brought up earlier when I talked about all the different pain brain changes is just, how we think about things and sort of flushing out the thoughts that we are starting to carry with us that are not helping us get better, and then starting to figure out how we can change those thoughts to get us going in the direction that we want to go. And there are three kind of mindsets that we've seen show up in doing chronic pain research that are probably worth talking about a little bit and getting to know. The first one is catastrophizing. So what does that mean? Catastrophizing means that we think something is worse, or we think the absolute worst case scenario about something, or maybe we think something is maybe more harmful than it really is. And that's, really something that I think happens very easily. And, I talk about, when I talk to patients, the power of words. Sometimes we hear our doctors or other people talking to us, and they're using words that sound pretty scary sometimes. And we start to think the situation sounds really bad or really, really dangerous. And that can sort of get us stuck in a box. And so we have tests that we use to evaluate how much a person is catastrophizing or how they're thinking about their health situation. And research has shown that when there's high levels of that early on, it might mean that the pain might be more chronic, might be more intense, and a person might be more likely to use stronger pain medications. So we start to see the value in diminishing unnecessary catastrophizing thoughts as a way of helping a person get in much better control of the pain they might be experiencing in the moment. Second one, my big three is fear. And this is a whole long topic we could talk about. But what I like to say is, I like to, when I talk with patients about fear, I like to break it up into two categories. One category is the sort of more natural, helpful, fears that we have. Like we're afraid to, run out, jump off a tall building, run into traffic, and that's protective, right? That keeps us safe. Those types of fears are helpful. But there's also the other type of fear that keeps us in a box and holds us back and doesn't allow us to move forward and get well. And those types of fears develop very easily in our mindset and how we think about things, and can lead to a lot of anxiety. And when that fear starts to become pervasive, then we get stuck, and we're in that sort of stuck mode again. Now, what I see, though, with that is it's really hard to know the difference between the fear that's protecting us from hurting ourselves and the fear that's really not and actually is holding us back. And how do you tell the difference can be really hard. The first step is just recognizing that there's a difference. And then the second step is trying to figure it out. And I think what really helps is talking to other people, other healthcare experts who know a lot about CRPS, for example, people who understand physical rehabilitation, understand pain psychology, those kind of things, and start to ask them, what sort of fears do they see that you might be harboring? And once you start to identify them, they become so much easier to tackle. And the third harmful thought pattern that we want to watch out for is anger. And when I talk about anger, the first thing I like to say is if you're in pain and you got something like CRPS, you got a lot to be mad about. You have every right to be upset, every right to be angry. There may have been all kinds of things that happened to lead you to where you are today. Maybe somebody did something they shouldn't have. Maybe somebody mistreated you. Maybe your doctors, don't listen. They haven't been, treating you nicely. The insurance companies, maybe they don't like you. They don't love you. They're not trying to help you. There are so many things to be pissed off about. But let me tell you, if you don't let that go, and if that becomes the all-encompassing thought process that you're dealing with day in and day out, guess what? If that's what's going on, where does love fit in? Because you can't have anger and love together. They don't coexist. And if the anger is pushing the love out, then you're not on the path that you want to be, and you're not going to have a great life with CRPS. So getting past the anger is a part of my big three. And then the flip side of that is, how can we heal things, and how can we change the way we think about things and take us down a different direction and a much more positive direction. One is acceptance, of course, which is hard. And, the whole topic of acceptance is complicated. And that you probably could have hours of lectures to better understand that. But what I like to say about it is, acceptance is not giving up. That doesn't mean you're giving in. That doesn't mean the CRPS wins. That doesn't mean the pain got the best of you. What acceptance means is you understand the problem for what it is, and you're gonna put it in a box. You're gonna deal with it, and you're gonna move on. It's just like, we're in the middle of a pandemic. And if you don't accept that virus is out there, you're not gonna really get past it. So this is something where we're not giving up, but we're actually just understanding what's what, putting it in a box, and moving on with things to a better place. My second healing thought pattern, shift is towards gratitude. And, one of the famous gratitude researchers out there, Robert Emmons, has a great quote that gratitude heals, energizes, and transforms lives. And we see very, nice studies done on gratitude and gratitude exercises, and the impact that it has on both physical well-being, physical health, and emotional well-being and emotional health. And we start to see that we become just much more happier in general when we bring more gratitude into our lives. I always tell my patients, though, research shows that when you're in pain, gratitude is really hard to feel and to do. We sort of push it away, and we have a hard time reconnecting with it. So you have to make it a special effort, a special exercise to start bringing the gratitude back in, even if it means writing down a couple of things or going through a gratitude meditation or whatever it is, but make a point of doing it on a regular basis to start to bring it back in. My third one is compassion. And of course, compassion, that jives pretty nice with working on bringing love back in. When I talked about the importance of love, to really feel fulfilled in life, we have to be able to express love to other people. And compassion is a great way of doing that, because that's when we're responding to people who need help, to the needs of others. And research shows that compassion is powerful, and it helps improve our relationships, helps improve our health, our cardiac health, all kinds of different things, maybe even prolongs longevity. Interesting compassion researcher did a study that he calls Counting Kindness. And basically, that's where you have people write down a couple of nice things that you do for other people every day. Just write them down. And what he found in his research is that if people start doing that just for a week, you start to see significant lasting changes in how we see ourselves and view ourselves and how we feel, which is really powerful. Exercise. So exercise and the brain. It turns out exercise has a big impact, a powerful effect on improving, enhancing brain function in many different ways. And an exercising body seems to stimulate the production of what we call these neurotrophic growth factors within the brain, which seems to boost brain power, increase gray matters and parts of the brain like the hippocampus that's involved with learning and memory. And so we start to see improved brain function, better stress regulation between the brain and the body. We start to see movement changes, all the different parts of the pain brain that we talked about earlier can get impacted in a positive way by figuring out how to bring exercise in. Now, we're not going to dive into that today, maybe another time, but how do you move and exercise a body that's hurting as much as it is when you have CRPS? That's a challenge, but it's something that, we probably want to talk more about another time. Another interesting thing going on in research on really health and pain in general has to do with this gut-brain connection. And what we're seeing is, learning is, what happens in the body has a lot of connection to what's happening in our intestines, in our gut. And as you probably know, our intestines are lined with all these bacteria. And we actually have more bacteria in our gut than we have our own cells in our body. So they kind of outnumber us. And what happens with these bacteria seems to connect with a lot of things that's going on with our health, both our physical health as well as our emotional, psychological health, and with our immune function. And the composition of these bacteria, as it changes or fluctuates, seems to correlate with a lot of different health issues. So we don't really fully understand how that explains so much about understanding pain better and something like CRPS, but we seem to think or see that there's a correlation or connection in some way. And it seems as though that the gut and the microbes in the gut have a way of communicating with what's going on in our brain, and vice versa. And the brain can communicate with what's going on in the gut. And we start to see this sort of interesting interaction. And we know that the gut can be changed by environmental things, like the food we eat, medications maybe we take, things like antibiotics, environmental toxins, things like that. So we start to, look at research, what kind of things can we do to improve the microbiome that we have to improve our overall health. And I'll give you what I call the rule of 7 when you're trying to figure out what to do. And this is basically, I use the rule of 7 every day when I'm planning, keeping track of what I'm eating. And basically what my rule of 7 is, try to have 7 different types of produce, fruits and vegetables every day. And if you can do that throughout the day, if you hit your 7 number, there's a good chance that you're exposing yourself to a really good nutrition plan that's going to be really good for your health, really good for diminishing inflammation in your body, and really positive effect on your microbiome. Last topic for you is sleep. The old Irish proverb, a good laugh and a long sleep are the 2 best cures for anything. And I think that, when I talk to patients, one of the biggest complaints they have, maybe secondary to only the pain, is difficulty sleeping. And we know that that's a challenge. It's hard to sleep when the body hurts. It's hard to sleep when the mind is restless. And what sort of things can we do to improve this? It's really important. The neuroplastic changes that we're trying to create for ourselves as we're trying to remodel this pain brain, they work better when we sleep better. And we know that when we're trying to learn things, a lot of the consolidation of that information, the cementing of the neurons takes place, at night while we're sleeping. And some, research studies done over the last several years definitely show that, when we don't sleep well, we hurt more during the day. And not getting good quality sleep leads to more difficulty with our pain management, which is not what we want. So having good sleep hygiene skills is really, really important. And I think, the more technologically advanced we get, the harder it is to have good sleep hygiene, and the more important it is to do that. And if you're still having a really hard time with it, research has shown over and over again that the best tool for treating insomnia or sleep problems is cognitive behavioral therapy for sleep, working with a psychologist who can do CBT work specifically focused on sleep. Seems to work better than anything we do, better than sleeping pills, and so might be worth looking into when you're working on your own program for yourself. And that's where we are. But I think my goal is to try to take some of this information and figure out what works for you, what resonates with you. How does the community you live in, the healthcare system you work in, the doctors and other providers like physical therapists or other providers that you work with, how can you take that and get them on your team and get them working with you to the best ways possible, so that we can, focus on those 5 key points, and so that you can have the great life that you need and deserve, and so that you can fly and soar just like Harry. So that is that's where I'm gonna stop presentation wise. I do believe we maybe have questions, and I'm going to see.
Hi, Peter.
Howdy.
I apologize for being late. had some technological issues out here in Connecticut. But
no worries.
Did you have an opportunity to talk about your program at the Bay Area Pain and Wellness before we get into questions?
No, I'm happy to do that. It does sort of resonate with the topics that we talked about. You know, all the different ways of empowering the person, because I think the goal that I have for every patient, you know, A, I want you to have a great life, and B, I want you to not have to need me forever. You know, if you can get rid of me, that you don't have to look at this face, you know, for the rest of your life, that's a win. And one of the ways that we help do that is through this integrated interdisciplinary program called the Functional Restoration Program that we started many years ago, and I think has been really impactful with a lot of CRPS patients that we work with. And basically, it's a structured, the way we have it right now, it's an 8-week program for 4 hours a day. And we go through different classes in a small group setting. You know, there is some exercise-based stuff, but there's psychology classes, what we call wellness classes, where we're doing the meditation work, the yoga, the Tai Chi, things like that, the breathing exercises. There's art therapy classes that we do. There's lectures from people like me you have to listen to. There's nutrition, a lot of different things that we cover, and different topics like, you know, how to communicate with your, you know, about pain, how to manage flare-ups, really important. You know, how to improve your mood, you know, sleep hygiene, like we talked about, all these different things, you know, we cover, you know, in the program on a week by week basis. And it's this really intense process. But I think for people who are really having a hard time, I think that kind of approach can be, a life changer, you know, in some cases. So it's an important part of what we do, definitely with our CRPS community that we work with.
Alexis, are you going to join us? There we are.
I didn't too soon. Well, all right. I've been in the background collecting a few questions that we've had come through. So I'm going to try to get through as many as we can. So one of the questions we have is, does the pain from CRPS cause the physical changes, or do the physical changes cause the pain?
I think what a person probably means by physical changes is you can look at, you know, your CRPS in many cases, you know, like your hand or your leg or your arm, and you can see all these changes. You know, maybe the skin looks different, the nails look different, maybe there might be color changes, temperature changes, swelling, all sweating, there may be all kinds of different things that you can see with this CRPS situation. And it's not always the case, but and sometimes that is the case. And you can see that. And why does that happen? What causes those changes? Which is a great question. And I think what happens is the way I look at it is a CRPS problem is a combination of changes in the peripheral nervous system, meaning the nerves that are communicating with your hand or leg, where the CRPS is, and a central nervous system disease, where all those central nervous system changes are taking place. And there's the communication of these two things going on, which leads to, you know, changes in like blood flow, for example, changes in how the sweat glands are operating, and changes in the way the nails grow. You know, these physical changes are the result of local feedback from the nervous system with that part of the body, but that local nervous system is getting feedback from the brain central nervous system, and so it becomes this very complicated disease, and that's why it's so hard to overcome.
Okay. So another question, definitely relevant to the time and everything going on. So, are those with CRPS more likely to contract COVID or coronavirus? Or what, you know, is there a correlation there, basically?
Well, I think, you know, I'm glad we're talking about COVID because it's so much in our minds, and it's such a source of anxiety. And because it's such a new problem, and it is one that I'm reading a lot about, studying a lot about, but because it's so new, there's so much about it we don't know. And so we don't know what the correlation or the impact that COVID could have on CRPS or having CRPS could mean to that. We do know that how well our immune system is working is going to affect how much a COVID infection can harm us. We definitely know that. And so, if we have CRPS, is our immune system, maybe not working as well? That certainly could be the case, if we're under a lot of stress, from our health problems. We know that there are certain immunosuppressive medications that might play a role, medications that maybe, slow down the immune response. But we really don't know the answers to the connection between CRPS and COVID. But what we do know is the basic things of social distancing, protecting ourselves, wearing a mask. We know that's going to help. We know that's going to help protect you. And sticking with the basics of what we do know, and taking good care of our health is going to help our immune system work better. And at the end of the day, that's probably all we know right now.
There seems to be a lot of discussion of cytokines in CRPS and also in COVID-19. Mm-hmm. In some of the literature, that's what I've been looking at too.
Yeah, the cytokine storm. Yeah, we're learning a lot about that, aren't we?
Yes.
Yeah.
Another question we have is, what do you think about electroconvulsive therapy for CRPS?
I'm not familiar with using it specifically for CRPS. I know it's an older form of treatment for depression, and of course, mood changes are often associated with CRPS, and there often can be a significant depression that coexists with a significant CRPS problem, and so certainly there can be that. As far as the body, how that affects the way the body feels, because electroconvulsive therapy, my guess, I don't know how a body would feel with CRPS after it goes through the treatment, so just not familiar with that.
Alexis, there was some citations in PubMed regarding ECT. Dr. Schwartzman did a case report on it too.
Okay, I'll definitely look those up and work with you, Jim, so that I can respond to the world asking the questions. Okay, another question that we have, and this one popped up when we were talking about exercise. It's something that a question that we also get a lot, is how do we keep the benefits of exercise without negatively impacting the disease?
I'm sorry, say that one more time, Alexis.
How do we keep the benefits of exercise without negatively impacting the disease? Yeah.
So that's a game to play, right? That's a big game to play. And there's a couple of little tips I can give you. And like I said, maybe we another time we have a bigger discussion about the exercise part, because I know what a challenge it is when you have CRPS. But one rule we use is, if you do something today and the next day you feel really in a lot of pain, like you can't move, you can't get out of bed, then we know that activity or that exercise was too much. But if you do something today, some sort of exercise or regimen, and the next day you don't feel too bad, then that was probably okay. And then you can build off of that. So you can kind of use the barometer of how you feel the day after to help guide you. We do that with our patients quite a bit.
A couple more questions that we have here. Someone asked earlier, does graded motor imaging help with neuroplasticity?
Yes. That's a great area of what we, big part of what we do. And, very, very much so. And I would encourage, the people at home to look into that more. You maybe have heard of, it's kind of interesting, but it has to do with how our mind and body interacts. We do something that maybe some of the listeners, you guys at home, have tried with your own clinical team, is the mirror box therapy. For example, if you have CRPS, say, in your left hand, and you put it in a mirror box that has mirrors around it, and you look at the mirror, and then you take your right hand next to the mirror, and you start doing things with your right hand while you look at the mirror, even though you're moving your right hand, it looks like you're moving your left hand when you look at the mirror, and that starts to train your brain to think differently about the left hand, and the connection between the brain and the left hand, maybe that says has a CRPS, starts to change, and then that helps you be able to rehabilitate the hand, as an example, in an effective way.
We've also had a few questions that pop up about ketamine, something that we always get questions about thoughts on ketamine infusions versus having another surgery, especially for someone who's already had multiple surgeries. Is there anything you can briefly speak on there?
Well, I think anytime we're talking about CRPS, ketamine, is always a topic of discussion, and the reason is ketamine is a strong pain relieving medication. It's a strong, powerful pain relieving medication, and also I think is a strong kind of mood. It can be a strong mood enhancing medication. So it has the ability to maybe diminish pain we feel, diminish maybe depression that we feel. So no question, ketamine is a powerful drug. The issue though is how do we use that in the real world to help people? And it's really hard to say. Different people live in different communities. One person may live in a place where they can go and get ketamine, and it's usually not a covered. It's not considered. It's considered off-label experimental treatment. I think in a lot of health plans, so people would have to pay out of pocket for it. And usually, if a person finds ketamine infusion to be helpful, they usually have to keep going back, on an ongoing basis to get the benefit. So then it kind of connects you to having to do this treatment on an ongoing basis, and having to pay for it probably. And so you have to kind of weigh the pros and cons of that in your own personal situation. Is that a good way to go or not? It definitely is a strong, powerful medication, and I think its potential has still not been fully tapped by medicine. And I think we're still trying to figure out how to make better use of it for patients. But, so.
Peter, do you prescribe LDN, low dose naltrexone?
We do. Yeah, low dose naltrexone, which we think maybe, I was talking earlier about the glial cells within the nervous system and exciting nerves into being into a bigger pain state, a more intensive nerve pain situation. And the low dose naltrexone maybe helps tamp that down and decreases that activation by those rascals, the glial cells. And so I think it's a newer treatment, but I think we're finding some benefit for some patients with it. So we definitely try it out.
I agree.
I know we have 2 more questions that I have written down here. I kind of merged these 2 together, but we have some people who are asking about stem cell therapy and radio frequency ablation. I hope I'm saying that right, for treatment of CRPS. Or either one of those 2, like any information about those 2 treatment options?
Well, maybe I'll start with the radio frequency question. And if I'm understanding what the person who's asked the question is thinking, when you're treating a CRPS problem, you sometimes can have a procedure, a nerve block procedure done, a sympathetic nerve block, either in the neck area to treat the arm or in the low back area to treat the leg. That's a type of procedure I do with patients sometimes. And blocking the what's called the sympathetic ganglion is usually how it's done. Now, some people will try to wipe out the ganglion with radiofrequency heat as a way of trying to maybe provide longer lasting relief of the symptoms. I personally don't think that works very well because I think the nerves are going to grow back. It's going to, whatever you ablate, it's going to grow back. And I think you maybe potentially can cause more problems for the person over time by doing that. So I don't personally recommend it, but my guess is there's probably people, in the community who've had it done, who've had good results with it. There's often a mixed bag with a lot of these things. So maybe my opinion about something may, someone else may have found, hey, that worked for me, so we see that a lot, but it's not something I usually recommend. Oh, and the other one was
stem cell.
Mm-hmm.
Yeah, I think we don't know the answer to that yet. And I think that's something we want to continue to follow. The stem cells are getting used for a lot of things, and we don't really know what the long-term results are or the outcomes are. And, I think that's something people are going to keep doing research on. And if it turns out that it can be helpful, that would be great. But I don't think we really know yet.
There's actually a clinical trial, I think in Montana, that's looking at stem cell therapy for CRPS.
That's awesome. Yeah, keep me posted on that.
And I also want to remind everyone to also consult with your physician, before trying anything. So please definitely do that. Definitely want to make sure that I'm saying that. And I know I have another question here about explaining the correlation between CRPS and mast cell disease. I know there's a few other diseases that I think have come up during the stream, but that was the first one that I saw. Like, do you have any information between the correlation between those two, or any other conditions that come to mind?
Mm-hmm.
I don't.
Okay.
Sorry. You could get stump me on that one.
No worries. Yeah, we have a good.
Alexis, we could post. There's been a couple articles on it in our library. We could post it tomorrow.
Definitely. So there's a lot of research on the RSDSA website that answers a lot of questions that I've seen come through. So I'm definitely going to go through and make sure that I'm responding to the questions that I'm noticing that we have articles on and things of that nature.
I would, if it's okay, I would like to say that we've done some interesting new studies in my own practice with virtual reality, using VR, and it's one of those things that it's not going to work for everybody, but when it does resonate, really powerful. And I was talking to a patient with CRPS the other day who had done a lot of VR work there's a startup company that's focusing on using VR for chronic pain that's doing some clinical trials, and they're doing some work in our office with some of the patients, and a really profound effect that it has had on his quality of life and his ability to do things with his CRPS hand that he wouldn't, could never have done otherwise. So I'm really excited about that, and building off of that in the future, and I hope that becomes, because it's so safe, it's not going to hurt anybody, and if it's therapeutic, it's really powerful, and you can start, once you get the equipment at home, it's something you can do on your own at home. And again, the goal is to not have to look at me anymore, right? So, but yeah.
So I think I'm going to wrap up with this last question. Kind of talks about spreading. So I've seen a few people ask about spreading and like how to prevent that, if there's a way. And then some people have even said that, the pain has kind of calmed down a little bit over the last few years, but just because, it's kind of gone dormant doesn't mean that it's gone. So, if the pain has kind of decreased a little bit, it's still possible for it to spread in the future.
Yeah, spreading is a thing. And I think studies seem to indicate that at least half the cases of CRPS that happens, maybe even a little more. And when you think about what we were talking about earlier with CRPS, it leads to all these different changes in how we process information in the brain. And so, for example, if I have CRPS in my left hand, and what I feel in my left hand, I start feeling similar things in my right hand, even though I never injured my right hand. It's because of the sort of crossover of information taking place in my brain, where it starts to think that those same types of pain symptoms I'm starting to feel in other parts of my body, or maybe my foot or my leg or somewhere else. And so it's this sort of windup of information building up in the nervous system that makes us start to feel the same exact symptoms in other parts of our body without even experiencing a new injury. And so that's definitely a thing, happens to a lot of people, and we don't really know a way of preventing that I'm aware of. But I think the management techniques and tools that we use for the original CRPS problem, we always use for the other parts of the body, where it spreads as best we can.
Peter, do do you mind us if we give your contact information out?
Sure.
Okay, that's wonderful. I really appreciate you. You hit a home run tonight. And
Oh, thanks.
It was really fabulous. Without
Thanks for having
baseball, you hit a home run. You know. But
CRPS warriors, man. You guys fight the good fight every day. You guys can teach the rest of the country how to get through what's going on right now. Believe me.
We have a wonderful, supportive community, and we're glad to do it. And we're going to do it again on June 4th. We're going to have Tom Scott, who's a compassionate anesthesiologist in Pennsylvania, be our next speaker.
Well, thank you both. I definitely want to wrap up by reminding everyone that we will have this video pinned to the top of our Facebook timeline. So if you started late or you weren't able to hear certain parts, anything, you can rewatch it as many times as you would like. It will be at the top of our Facebook timeline. We will also add it to YouTube. The link to the presentation will also be included there. We will also add that to the description in our YouTube channel and on our YouTube page. So if you have any questions, if you need a support group, if you're looking for a new physician, if you want to tell your story on our blog, just send us an email at info@rsds.org and we will get back to you. And I'm definitely going to be in the comments responding to a lot of the questions. And we'll also have a call for questions for our next Facebook Live, so be on the lookout for that. But of course, thank you both. I appreciate you taking your time this evening. I know everyone here really appreciates it as well, so thank you.
Take care, Alexis. Thanks so much. Bye, Peter.
Bye-bye.